The children are mostly back at school, the daffodils are blooming, the sun is peeking through, and the government's scientific advisors are worried. Relaxing too much, they said today, will see another wave.
As things are opening up, what all the modelling suggests is at some point we will get a surge in virus. And whether that happens, we hope it doesn't happen soon, but it might, for example, happen later in the summer if we open up gradually, or if there's a seasonal effect, it might happen over the next autumn and winter.
And that surge, he said, will find the people not vaccinated or where the vaccine has not worked. Earlier modelling from Imperial College showed a significant number of deaths. 30,000 was one number if restrictions were eased in July.
It is really important that we do not give any impression that what we're expecting is this just goes away and there's no further deaths. That is not realistic, and I think to pretend that to the British public would be completely wrong.
It's almost a year to the day since the World Health Organization declared COVID-19 a pandemic. And the disease modelling we have come to know so well does take into account public fatigue with lockdowns and school closures. Nevertheless, the chief scientific advisor warned the same committee against any shortening of England's roadmap timetable.
The perspective of our advice was to make sure that you really have enough time to measure what has happened in response to each change, and then decide whether you've got room to make the next change, either on the date that's been announced or delaying if you have to. So I think nobody would say that we know exactly how this is going to roll out over the next few months. And the important thing is to measure, adapt, and take decisions in the light of information as it emerges.
The 5-week gap between each step in the roadmap, starting with testing at schools this week, is designed to give the scientists enough time to analyse the data and seek out its significance. And today's messaging was clearly as much aimed at those MPs pressuring the government to speed up the unlocking in England as it was for the public, who have been largely compliant. Shortly after the message was delivered, however, Scotland's First Minister did just that and ease some restrictions.
So from Friday, we intend to relax the law so that up to 4 adults from up to 2 households will be able to meet outdoors. And in addition, we will make clear in the guidance that this will allow for social and recreational purposes as well as essential exercise. Meeting will be possible in any outdoor space, including private gardens, but please do stick to the new rules. Gatherings must be a maximum of 4 people from 2 households, and you should only go indoors if that is essential in order to reach a back garden or to use a toilet.
In England, groups of 6 will not be allowed to meet outdoors until March the 29th, with pubs, hairdressers and gyms not due to reopen until the middle of April, if the numbers continue to fall.
Victoria MacDonald. Well, joining us now is Professor Christina Pagel. She's the Chair of Operational Research at University College London and a member of Independent Sage. Professor Pagel, it's nearly a year since the first deaths were reported, but we're still getting daily warnings about this virus. Are we ever going to be free of it?
If you're asking, are we ever going to go back to kind of minimal restrictions, then yes. Yes, we are. Are we ever going to be in a situation where there's no case of COVID ever? No. I think what Chris Whitty was saying today is that if it does end up being kind of dates and not data, and we just relax everything currently in mid-June, which is what that would mean, then you still have something like, 20, 25 million people in the UK that haven't been vaccinated. And so you still have a lot of opportunity for the virus to spread and potentially then also infect and make very ill older people who either haven't had the virus or haven't had the opportunity to get the virus because of other reasons.
But mask wearing and distance regime, that will be for the foreseeable future?
Well, to be honest, I hope so. The one thing that all of the SPI-M, the SAGE modelling subgroup model said, is that even just baseline restrictions, which is kind of some social distancing, some mask wearing, kind of where we were kind of at the beginning of September last year, has a massive, massive impact on transmission and can keep cases much, much lower than if you just release everything. So I think it just puts us in a much better position for winter if we do just some basic stuff. It doesn't mean lockdown at all. It doesn't mean things have to be shut. It just means taking some kind of sensible precautions this year.
Will we ever get to a point where there is no more COVID? No.
In the world or here?
Well, here would do for a start.
Well, I think, to be honest, what really worries me is that we might end up in a situation where we have very little COVID, but you have pockets of it, particularly in deprived communities, a bit like what's happened with tuberculosis in the high-income countries, that it ends up being a disease of poverty. And that's because we've seen it the whole time that people in deprived areas are more exposed to COVID. They tend to get sicker when they get COVID, and also vaccine uptake is lower in those areas. And so that's what worries me, is that we'll end up with kind of persistently high, small pockets, and we'll think that's okay, whereas I don't think it is okay.
Well, now, the government does seem to be more cautious now. Do you think they're finally getting the messaging right?
I'm really glad that they are being more cautious. I am. I'm really glad that Boris Johnson yesterday said, it depends on what happens with schools. They're a big unknown. If we can open in mid-April. I think that given just how well the vaccination programme has gone, and it has gone stonkingly well, they are very reluctant to risk it. And that's the right approach. Right? We want to make the most out of the strides that we've taken, and even slowing down by 3 or 4 weeks. I mean, at the rate we're vaccinating now, that could be vaccinating, 12, 15 million people in a month. I mean, that's a big portion of our population. So it's kind of not waiting that much longer to be a hell of a lot safer.
And is the Prime Minister right in saying that using data, not dates, is probably the best way to make decisions?
Well, it's absolutely the best way. I mean, how can you just put dates in the sand when things change all the time, like in terms of the vaccines, in terms of what we're learning about them, in terms of new variants which are popping up everywhere and new information? Like, how could you possibly think that having some kind of arbitrary timetable is better than looking at what's happened and learning from it?
Professor Christina Pagel, thank you very much indeed for joining us.